patient's room. I can see that there is a falls risk on the floor. Good morning. I'm just going to remove this if that's all right.
Yeah.
Is that okay? I'm just going to move it out of the way. I'm not taking it away from you. I'm just going to pop it out of the way so neither of us fall.
Okay.
Okay, lovely. So, good morning. My name's Sarah. I'm your nurse for today. And I've just come to have a chat with you about some of the assessments that you've been having while you're in hospital.
Yep. Okay.
Is that all right?
Yeah.
Do you mind
Yeah.
if I take a seat?
Yeah, that's fine. I think Wendy's, my wife's sitting there.
Okay, would you like me to get another chair and leave that one for Wendy?
Yeah, please. Yeah.
Okay, no worries. There we are. Okay. So as I said, my name's Sarah, and I've just come to have a chat with you this morning. So before we get started, can I just check out who you are, just to make sure I'm talking to the right person? So I've got some details here. Could you confirm with me your full name, please? I'm just going to look at your wristband.
Yes, Liam Appleman.
Yep. And your date of birth?
It's the 2nd of the 3rd, 1954.
Okay, and I can confirm that I've got Liam Appleman, 2nd of the 3rd, 1954, and I've got an MRN number of 986532. Lovely. Thank you very much, Liam. And do you mind if I call you Liam, or would you like Mr. Appleman?
Mr. Appleman, please.
Mr. Appleman. Okay, lovely to meet you. So I'm going to just sit and have a conversation with you. I'm also going to be completing an assessment tool called the Mocker assessment. Are you familiar with that?
No.
No, okay. Well, it's this one here. It looks a little bit like this, and one of my colleagues filled it in with you earlier.
Oh, yeah.
Yeah, the one with the lion. I always remember it that way. Okay. So, Mr. Appleman, I'm going to fill that one in a moment. Is that okay with you?
Yeah.
Okay. So before we get started, can I just say, we've got some cigarettes here. Do you smoke at all?
Oh, yeah. Have you got a lighter?
I don't have a lighter, I'm afraid, and we are going to have to ask you that you don't smoke while you're here with us, okay, because this is a no smoking site.
I didn't know that.
Oh, you didn't know that? I'm very sorry. So what we can do is I can either give these to your wife, Wendy, or I can pop them in a locker for you.
Oh, I'll keep hold of them. I'll keep hold of them.
You want to keep hold of them?
Yeah.
Okay. I would really like it if we could put your possessions somewhere safe, so they're all in one place. Would that be okay?
Yeah, all right.
Yeah, is that okay?
Yeah, okay.
So what we'll do is, if you remember, I'm going to pop them in this locker for you, so they're nice and safe, and if you want them at any point, you just speak to me.
Okay.
And then when Wendy comes in, we'll make sure we tell Wendy as well.
Okay.
Okay, thank you. Thank you very much. And do you smoke often?
Oh, good, yeah. About 2 of them a day?
Two packets or 2 cigarettes?
Oh, 2 packets.
2 packets. And have you been smoking long?
Oh, all my life, yeah.
All your life? Okay. So have you ever thought about quitting smoking?
Oh, no.
No? No? Is it not something that's been suggested to you before?
Oh, they always say it, don't they? But nonsense, isn't it?
Nonsense. Okay. Well, that's really interesting to hear. We've got some information about quitting smoking and facilities that we have here and groups that can support you. Would you be interested in having any of that information?
No.
Okay. Well, if you change your mind, you let me know.
Okay.
Okay. So, Mr. Appleman, I note that you've got some glasses here as well. Do you need these glasses now?
No, they're just for reading those ones.
Just for reading. Okay. Well, if you pick up your novel, let me know, and I'll hand those over to you. I'm going to keep them safe and just move them out of the way for the moment. So, Mr. Appleman, are you in any pain at all?
Yeah, it's got a bit of a headache.
Bit of a headache.
Yeah.
So could you score your pain for me, please, on a scale of 0 to 10, with 0 being the least pain and 10 being the most pain?
Already, 3 or something.
A 3, okay. And do you feel like you need any analgesia or pain relief for those?
Oh, no.
No? Okay.
Don't
Will
take
you
that
let...
nonsense.
No? Well, you let me know if you change your mind, and I can have a look through your medicines chart and see if you're due any medication. Okay? Are you in a comfortable position there?
Yes.
Yeah? And do you need anything else, any of your possessions?
No.
No? Okay. And do you need to use the bathroom or anything?
No.
Have you been told where the facilities are?
Yeah. The lady earlier did tell me where they were. Yeah.
Okay, lovely. So what I'm going to do is I'm just going to get started with your chart, if that's all right,
Yeah.
and then we'll have a chat through about that. Okay, so I can confirm that my patient's name is Liam Appleman. I have it documented here that his education age is 11 years, his gender is male, his date of birth is the 2nd of the 3rd, 1954. And I'm going to fill in the date, today's date. Okay, lovely. So before I calculate your score, Mr. Appleman, I'm just going to confirm that all the details are correct and filled in.
Why are we doing this one again?
So So this is it's called a MOCA, we call it, and it's a cognitive assessment. So it's to see whether you're able to complete some activities here that we've set out, okay? And from that, we can look into your memory, how you are looking at familiar objects. So one of the questions, if you remember, is a picture of a clock, and we asked you to draw that. So that's to see if you're able to remember that common familiar picture and whether you're able to write that one down on here, okay? And this helps us assess your memory and your cognitive function, okay? Because I understand you've been feeling a bit confused at the moment.
Yeah, a little bit confused.
Yeah, and a little bit of memory loss.
Yeah, I can't remember why I'm here, to be honest.
Okay, well we'll chat about that one in a minute if that's all right. So I'm going to complete this one through. Okay, so the total points are 21, but because Mr. Appleman has an education level of 11 years, I'm going to be adding an additional 1 point to his score. So I'm going to be giving him a score of 23. So Mr. Appleman, I've calculated your score, and your score is 23, okay? So 23 is a little bit below normal, okay? So it's a little bit lower than we'd expected. And I think that sits quite true with the fact that you've been having some confusion and some memory loss. So can you tell me what kind of episodes of confusion have you been having? What have you been experiencing over the last few weeks?
I just can't really remember.
You can't really remember?
No.
So have you been doing your normal daily activities?
The wife does most of my stuff. Yeah, Wendy, she looks after me. Do you know where she is?
As I'm aware, Wendy's just gone to get you some clothes. So she's just popped home to get you some spare clothes, and she'll be back with you shortly.
Okay.
All right?
Yeah.
So what kind of things do you and Wendy do in your day? Is there something you like to do? What kind of things do you do during your day?
I get up and around midday, and then we normally we'll have a wash, get dressed, have some lunch together, and then before we go and have a few drinks.
Okay.
But yeah.
Yeah. So you're getting up about midday,
Yeah.
and when you're having a wash, are you washing independently, or is Wendy there to support you?
No, Wendy there. She
Wendy
helps
there
me.
to help you
Not
out.
really staying with feet these days.
Okay, getting a little bit wobbly.
Yeah.
Okay, and do you have any aids or supports to help you?
No.
No. And whereabouts do you live? What kind of house do you live in?
Just just a house.
A house?
Yeah, yeah.
Stairs? Do you have some stairs?
Yes, yes.
Okay, okay. And how do you find getting up the stairs?
Takes me a while, but I can do it.
Yeah, and you're
Yeah.
feeling safe when you're walking up the stairs?
Safe as you can be, yeah.
Okay. Well, what I might like to do is just look into referring you to our OT team, and this is the team that will come and assess your house and maybe provide you with some assistance
Yeah.
and some grab rails just to help you feel a bit more supported as you're walking up the stairs.
Yeah.
Okay. And we can even look at getting an assessment to see whether you're suitable to be climbing the stairs at all.
That's it. Yeah, see what Wendy says, yeah.
Yeah, we'll speak to Wendy. So you've mentioned that you wake up at midday. How do you sleep at the moment, Mr. Appleman?
It's not very good. I just get really bad thoughts. I just lay there awake all night just thinking, worrying about everything.
Okay, so you're saying that you're laying in bed, so you're going to bed, but you're just unable to stop thinking.
Yeah.
Okay, and worrying.
Yeah, yeah.
What kind of things are you thinking and worrying about?
Just Wendy in the house and the bills and all that sort of stuff, and just everything really.
Just everything. And do you have any support to help you sleep at all? Do you take any medication, or do you like to read or listen to music in the evening?
I just normally have a few drinks that helps me, sets me off nicely, but then I end up waking up and it's just away with them.
Yeah. So when you say drinks, what are you drinking?
It depends what day it is really.
Okay. So what kind of things do you like to drink?
So vodka and cokes.
Vodka and Coke.
Like whiskey.
Whiskey. Okay. And do you drink vodka and whiskey regularly?
Most days, 4 times a week.
4 times a week?
Yeah.
Okay. And is that something you've been doing for a long time?
Oh yeah, yeah.
Okay. And how do you feel that helps you sleep?
Just relaxing. I find it a bit more relaxed after I've had a couple of drinks.
Okay. And what kind of time are you getting into bed?
Probably about 1 o'clock, 2 o'clock.
1 o'clock, 2 o'clock. Okay. And have you ever tried changing your sleeping pattern at all?
No, that's just what I've always done.
What you've always done? Are you quite happy with that?
Yeah.
Lovely. Okay, thank you. Thank you very much for sharing all that information with me. So as I've gone through your score is 23, because your score is 23, we'd like to reassess you on this score. This gives us a nice baseline of where you are right now,
Yeah.
but I'd like to assess you again in 7 days just to see how this score has changed. Would you be happy with that?
Yeah.
And also, because your score is 23, I'd like to refer you to our neurological team. Okay, so refer you to our doctors here,
Yep.
for them just to come and have a little look at you, have a chat with you, and see whether there's anything they can do to support you.
Okay.
Is that all right?
Yep.
Are you happy with that?
Yeah.
Okay. So we've spoke about a few things during my visit. We spoke about how I'm going to escalate this to our doctors and how I'm going to reassess you within 1 week. We've also talked about your cigarettes and how I'm going to pop those out of the way and give those to Wendy when she comes back. We've spoken a little bit about drinking and sleeping and your mobility. So what I'm going to be doing is escalating that to your doctor so they can support you with some of those issues. Is that all right?
Yeah.
Okay. So before I go, Liam, are you comfortable?
Yes.
Yes. Okay. Do you have any concerns about why you're in hospital today?
I can't remember why I'm here.
Okay. So your wife brought you into hospital because she was a little bit concerned that you were unable to remember to do things around the house, such
Yeah.
as turn off the stove or lock the doors.
Sure, it's moaning about me not doing the washing.
Does she moan about the washing?
Yeah.
Most wives do. So she was a little bit concerned that you were going to forget something that could put you at harm. Okay, so I think Wendy just wanted to come and bring you in and have a chat.
Okay.
Is that all right? Do you
Yeah.
remember that now?
Yeah. Yeah.
Okay.
Something about it, yeah.
Okay. So are you comfortable?
Yeah.
And how is your pain now?
Still a bit of a headache, but it's okay.
Okay, what I'm going to do is make sure you've got some water, make sure you stay hydrated. It's a hot day today. And how's your position? Are you comfortable?
Yes.
Yes. And do you need me to support you walking out to the bathroom or anything?
Not at the moment, no.
Okay, lovely. Well, it's been really nice to meet you, Mr. Appleman. Is there anything you'd like to ask me before I go?
Oh, can I go for a cigarette?
Can you go for a cigarette? Okay, so we are a no smoking site, but sometimes our patients, if they need to, can leave site. But we can also offer you some nicotine replacement therapies.
Yeah.
So we can offer you things such as tablets and patches to be able to support that need.
Yeah.
Is that something you would like me to do?
Yeah.
Okay, so I'll refer that and let your doctor know. Okay?
Yep.
Lovely.
Thank you.
Thank you very much. Lovely to meet you.
Thank you.